Today, we're going to cover some best practices for creating a healthier and a safer workplace for your employees. So let's just kind of dive right into some of the things that I wanted to talk about briefly. So let's look at some of these best practices. So we're living in this scary reality, right? Getting back to normal, as we've said, these past few weeks may or may not be possible. And we've been discussing it over and over again. And I'm sure you guys have been on other webinars and have listened into other videos and have read many articles about it. Because when it comes to going back to the office, it's still your responsibility as the business owner, your responsibility as the leader to ease the concerns of your employees. You know, health and wellness in today's world it has taken on a whole new meaning than it has in the past. So where do we start? I know last week we talked about the importance of following the guidance that has been provided to you. And mainly I talked about doing that in a sense to where you make sure that you're protected from liability concerns. But that's kind of where I want to start off a little bit today, because it's very important that we consistently review and monitor the health guidance that's out there, because the CDC, they provide up-to-date guidance on how we can reduce the risk of transmission in the workplace specifically. Right? The CDC and OSHA, they do these risk assessments that can actually help businesses like yourself to in instructing you on what basic steps that you can do to reduce the risk of this exposure in your workplace, in your offices. And this guidance, not only does the CDC provide, you also have other public health guidance that's out there that is updated periodically that includes more information way above what I can cover in 30 minutes and now 15 minutes with my internet issues. So there's so much out there for you to be able to look at. And we understand that the media provides us a lot of information and it can get overwhelming at times. But also I want to bring up something that I was listening to a webinar not too long ago, and something one of the attorneys said to me kind of stood out, and it was, hey, pay attention to what your employees see. Keep an eye on the news, because their perception is reality. And when they see the infection rates going up on the news and death rates being reported daily, to them, it's a scary thing, right? And again, going back to something I said a minute ago, it is your responsibility to ease their concerns because that is what they see. So always stay in tune to that. Manage your office hygiene. This is very critical. Employers are definitely advised to encourage your employees and actually consider requiring them to practice certain hygiene practices, such as hand washing, coughing and sneezing etiquette, proper tissue disposal, using hand sanitizers, things like that. And so I listed a couple things here to always keep in mind, like hygiene stations. I'm sure some of you have them or at least plan to have them when you guys reopen. It's important to keep them stocked. That's the main thing, that when you go in different places, they're not stocked. They might be low or something like that. So you want to make sure that you're always completely stocked. And another thing, cubicle hygiene. How many of us work in cubicles or in close proximity to other people? Yes, Sherry raised her hand. Yes, cubicles are horrible. Did you know, now listen to this, the average desk contains 400 times more germs than toilets. 400 times more than toilets. 67% of workers have lunch at their desk. The phone on an office desk typically harbors the most germs with an average of 25,000 germs per square inch. So think about these things. And 20% of your employees, and maybe yourself, never clean your mouths. So think about the germs that are out there, right? So you have to encourage or require your employees to wipe down their keyboards, their mouse, their phone, their services, any surfaces before and after they use them, just for that added precaution. Increased cleaning is something very important. Your offices may use some more abrasive cleaning chemicals, and you also want to keep in mind OSHA. Anytime you're using chemicals that employees are having to breathe in, you have to make sure that you are following OSHA guidelines when it comes to the chemicals that you guys are using. And even if you hire somebody from the outside, a contractor, to do the cleaning for you, understand what they're using too, so that you can make sure that you're following all the necessary guidelines. Because an employee can come to you and say, hey, I need to know what you guys are using. You should have a list of all of the chemicals that are used that are coming in contact with your employees. So, and always make sure that you tell them never to share equipment. And what's going on right now, we cannot share equipment. Workers should not use other workers' equipment or work tools, if at all possible, without necessary cleaning and sanitizing and things like that. PPE, we've heard this so much, but what I want to talk about PPE is to consider whether you're actually going to require the use of PPE. There's a difference of saying, hey, we require that you have PPE, or we recommend that you use PPE, whether it's a mask or whatever you're doing. For instance, if you have employees that have to take the elevator from their office to another office, if you're going to require a mask, you have to think about those things. What's going to happen during those elevator rides, right? It's like if you get on an elevator, now everybody's afraid who's going to go in, who's not going to go in. Do they have a mask on? Do they not have a mask on? So we have to keep that into make sure that we understand that too. And will you provide PPE if you require it? That's another thing. And if you think about requiring PPE, make sure that you have the right PPE, the standard PPE and I'm going to say this real quick, PPE has been used loosely, and this is something that an attorney pointed out not too long ago, because there are standardized CDC PPE that are used. Regular masks that people wear, they're all not considered PPE. So just make sure that you understand what's that standard PPE that qualifies for standard PPE. So yes. So is it required or is it not required? Another thing, make sure social distancing. We know we hear the 6 feet and all of that. Everybody's heard that so many times over and over again. But think about it from your workspace perspective, right? Separation of your workspaces. Looking at physical separations. Are they adequate? Are they not adequate? Can you change the physical layout? Thinking about other measures that you can do besides reconfiguring your workspace. How can you reduce the number of employees in a particular area? Can you incorporate plexiglass? Can you not incorporate plexiglass? So we have to keep those things in mind too when we're talking about social distancing. Common areas. Before anybody comes back to your workplace, you have to look and do an audit of your physical space. We all have break rooms. We all have places that people congregate. The print at my place of business, people congregate at the printer. You can have a whole conversation at the printer, right? So you have to think about those spaces where people commune together that at one point didn't make a difference, but now it makes a huge difference. So spread out your workstations. Now I can tell you what CDC recommends, and they recommend that common areas be closed off, or the number of people that are in these common areas are reduced to literally nobody almost, right? So we have to make sure that we are taking that into consideration, and always limit in-person meetings, right? Of course, we like to have in-person meetings. I was at a meeting this morning and there were 3 people in this meeting, but the room was huge. So we had 3 people, one on one side, I'm in the back, and the other one was in the front. So if you can do that, great. But if you can't, you have to think about other ways in order to have these meetings. Another one is shift schedules, but you got to be very careful when it comes to shift schedules, because if you're working with the union and you have a contractual agreement, you can't really shift schedules without actually talking to somebody first about it. And you just want to make sure that you do that. You want to make sure that even if you start staggering start times, leave times, that's something that you can, if you can work it out, do the best that you can to kind of get everybody back to work, if it is at all possible. And again, these are just recommendations, is if it's possible, right? Employee training. I'm an advocate for training. I'm an advocate for educating employees, so we can implement all of the health and the safety protocols we want. But let's be honest, if employees don't know how to follow them, it doesn't matter how often you put it on a board, you send an email, they have to be trained on how to use them. So you can develop some training materials to cover things like social distancing measures that you're going to take in your workplace. You can talk about how to protect yourself and others through how to use the proper hygiene and sanitation, and also about not going in public places if you're feeling sick, things like that. So always keep that in mind. Visitor protocols. Now, some of you have to have visitors, but if at all possible, try to limit it. Most attorneys will advise you to limit visitor access to your workplaces. Now, we understand that there are going to be some times where there has to be an in-person visit if it's critical, and even if that, consider having something like a visitor self-screening questionnaire that you can provide prior to them coming in. Because when you think about visitors coming in, you have to think about all of the people that they came in contact with prior to even getting to your place of business. What type of protocols are they having at their place of business? So you want to have that open communication with visitors, but if at all possible, try not to do it. But if you have to, have some sort of agreement. If you have to use contractors, have an agreement or commitment from them that, hey, these are the protocols that we use. These are the steps that we have to take at our business. If we come in contact with somebody who has COVID, you can ensure them that you will keep them updated and abreast of what has happened with them. Because think about this, and this is something that attorneys has pointed out, is that now you have to take necessary quarantine measures when somebody that you've invited into your workplace has had some sort of contact with COVID-19 and they trace it back. So you have to be very careful with what you're doing for your business. But I can't stress enough, if there's an alternative way of doing it, do that. All right, so let's look at monitoring employee health, because this is another big issue that's out there. When it comes to asking people about their health, you have to rely on the EEOC to protect you, okay? To protect you. And they have a series of guidance memos for you out there that helps you with how to monitor employee health the right way. And I put this here on this slide. If you ask about symptoms, keep it specific to COVID-19 and keep it simple. Keep it simple. Yes. EEOC says you can take temperature. EEOC says that you can even require tests before coming to work. But at the same time, we have to remain aware that there are federal privacy protections in place for a reason, and we cannot just throw that all out the window because we're all frantic about COVID-19. You have to make sure that you understand what you can and what you cannot do. And OSHA tells you you can do temperature screening, but if you choose to do temperature screening, if you can, hire somebody to do it for you. Now, if you can't, and most small businesses cannot do it, make sure that your employees understand the privacy of temperature screening, and make sure that you're doing it in a way to where employees don't come in contact with each other during the temperature screening process. Even that you have proper exits when they get the temperature screen and then they leave and go the other way. What gets me is that you can have someone doing temperature screenings and then they yell out your temperature. Well, if I'm 6 feet behind them, I just heard what their temperature was. You know, is that good information for me to know? Yes, considering I might have come in contact with them, but privacy and from the employer standpoint, no. That's not good. So we have to take into consideration that as well. Self-reporting, make sure that you encourage a process that they can provide to you in writing, their obligation of what they have to tell you as the employer as far as their symptoms and what they, if they've come in contact with someone or if they've tested positive. Make sure that there is a proper way for them to self-report and that you've trained them on how to do it. Always maintain confidentiality. That's the #1 rule. Make sure that you adhere to the EEOC and the ADA when it comes to this type of keeping medical documentation when it comes to COVID-19. And lastly, in order to manage the spread of the virus, we have to make sure that there's those what if scenarios, right? What if an employee refused to be tested? Well, you might have that happen. Well, if that happens, have a response ahead of time, ready for that to happen before you open your doors, before you let people back. Even now, if you don't have standard language, make it a point to have standard language of the steps that somebody has to take if they refuse to be tested. Can you bar them from work? Yes, but don't just be barring employees or having them refuse to come back to work without asking additional questions. There could be religious reasons why they don't want to get tested. Again, there's a lot of liability concerns out there. If someone tests positive or presents symptoms of the COVID-19, what do? Well, the CDC tells you what you should do. They let you know, okay, how many hours a person should quarantine. Should you require a test? Are you just going to require them to sit out 7 days, 14 days, or whatever it is? But make sure that you're following the guidance that is out there for you. The CDC has guidelines for employees who test positive, for when they cannot return to work. All I can say, guys, and I think I only have like 2 minutes, the CDC, OSHA, and EEOC should be your new best friends, okay? Your new best friends when it comes to safety and health and the health of your employees when they return to work. It is our responsibility as business leaders, as business owners, to provide this for our community, for our workers, to help them protect them against COVID-19, and this helps us with our business continuity as well. So guys, I know I kind of rushed through that with not only really having but 15 minutes to talk to you, but I'm always here. Okay, I'm always here. You can always reach out to me. I'm very, very approachable. Just shoot me an email, call me. It doesn't matter, and I can talk to you more about it one-on-one. If you need me to help you in creating some policies, new procedures, whatever it is, or if you just need help with some day-to-day stuff and you say, hey, Lynn, we need help. Can you help us? Reach out to me. I'm here for you. It's been a great 4 weeks. Amanda, thank you again. And thank you for the ones that have been with me for these last 4 weeks. You'll be receiving something from me via email soon, so be on the lookout for that. Thanks again.
Lynn, this has been amazing. Thank you so much for doing this series. I have a whole bunch of notes from today, as from the previous 3 weeks too. We did have one question, and I just wonder if you can direct them as to where to find this. If somebody is handling cash in their business, we all know that cash is notorious for carrying germs, period. But right now, so they're asking, should they have staff be wearing latex gloves for handling cash? What should the processes be? I'm assuming that probably the CDC has guidelines, but would they look to the CDC? Would that be a EEOC, or would that be an OSHA thing? Where would be the best place for them to look for to develop a policy on cash handling?
My first mind will always go to have them using latex gloves to handle cash. But as far as who to reach out to, I can almost probably guarantee you that all of them will have something on it, whether it's the CDC, whether it's OSHA, maybe not so much as the EEOC, but the CDC and OSHA will probably have some guidelines out there for them on that. But always err on the side of, hey, I can protect them by at least requiring that they use latex gloves, because with the latex gloves, they can at least take them off. I've even gone in an establishment where they are not even accepting cash, period. That they have a note that says card only. So, and then there's a shortage on change too. So there's just so much going on, right? There's so much going on right now. But if they need me for any, if they need more information on it and need some help on it, just shoot me an email, and I can look up some specifics for you on cash handling.
Perfect. Thank you. I think the one big takeaway for all of us from this 4 weeks is that we have to have some standardized procedures. We have to have protocols and procedures in place ahead of anything becoming an issue. And so, you know, for everybody that's on here, I would highly recommend you contacting Dr. Johnson to work through. If your policies and procedures are anything like most businesses, they were last written in 1983 and probably revisited twice since then. So let's make sure they're up to date. And Dr. Johnson can help and advise you with that for any size of organization. So I just want to say thank you for joining us. To Dr. Johnson, thank you again. Triumphant HR Solutions is the way to go, and it's been a pleasure working with you, and I look forward to doing lots more seminars moving forward. So thank you all for joining us. Enjoy the rest of your Monday.
Thank you,
have a wonderful, thank you. Take care. Bye now.
Bye-bye.